It is my pleasure to move into the, to help us all move into the so what part of the day. As John mentioned this morning, we started with the what. It's kind of the space we've been in all morning, part of the early part of the afternoon. And we have a wonderful group of panelists here to really dig into the so what. So what does this mean for us, for individuals, for the sector, for organizations? I'd love to introduce my panelists briefly and then ask them to say a few words about their own work, as well as how they're hearing and seeing and perceiving all of this next generation evaluation stuff through their own lens. So we've got Lee Shore, from a senior fellow at the Center for the Study of Social Policy. Alicia Greneau, who is a senior managing partner, design, development, and improvement research at the Carnegie Foundation for the Advancement of Teaching. And finally, we've got Faye Twersky, who is director of the Effective Philanthropy Group at the William and Flora Hewlett Foundation. So I'd like to start with Lee and give her a chance to really introduce herself in more detail and kind of react, top of the mind reactions and thoughts about next generation evaluation.
Thank you, Sri. Thanks for the opportunity. I totally agree with the premises that FSG has laid out in its analysis, that current trends in the social sector require that evaluation evolve. If the major indicators of well-being in this society are going in the wrong direction, as John Kenya said this morning, if we're going to try to do something about that, if we're going to try to improve lives on a grand scale, I think we have to shift from simply trying to prove what works and trying to learn more about what works and how and why. And that's why I think the FSG analysis has really more profound implications than you've laid out for us, or at least than can be captured under the idea of improving evaluation. I think that next generation evaluation won't take us far enough. I think what we've been hearing about today suggests we need to take a new approach to knowledge building, a new approach to what is credible and valuable evidence. We here are getting away from program evaluations. Great. But we're still pulled back down into thinking that our information, our knowledge for doing better in the future than we've done in the past is going to come from understanding programs. We have to draw on a much bigger universe. Right? Take home visiting. Home visiting, we have some wonderful random assignment evaluations that prove that home visiting can work. But if we look, for example, at what the Harvard Center on the Developing Child has identified as the biggest risk factors for child abuse, we know that drug abuse, that maternal depression are huge risk factors, which most of the home visiting programs haven't gotten at yet. At least the proven home visiting programs haven't gotten that yet. That we've learned that housing is huge, but that comes from a different set of knowledge than what we learned from home visiting. So we, I think, have to be much more inclusive in what we try to learn from than just our programs. And can I just say a word about those charts that have been distributed? I've distributed a chart that you don't have to read right now, but the main point, but take it with you. The main point of that chart is that the top row is what we've been thinking about in evaluation. It's evaluation for accountability, it's showing what works, and showing what works even to improve, which is where we are in this room, where not everybody else is. But there's a lot more knowledge that we need to build on if we're going to be able to really improve outcomes in the future. And so I think we have to resist being stuck on that first row and start moving as we have in this room, but as not the rest of the world has not, to a much more inclusive kind of knowledge building.
Thank you, Lee. Alicia?
Thank you. So my name is Alicia Gruno, and I work at the Carnegie Foundation. And the Carnegie Foundation is an educational institution, actually right here in the Stanford area. And what our mission is, in the field of education very specifically, is going to go back to a theme that we've heard in all of the presentations so far, is really about learning. And so what we're united around for the last 5 years, trying to figure out a way to how can we accelerate the field of education's ability, their capacity to learn how to improve. So echoing your remarks really about what does it take to improve and what does it take to learn. So I think that I share some of the resistance to frame this under evaluation. And not because actually of the word evaluation per se, but because of how we tend to think of evaluation, right? So we tend to think of evaluation as, you design something, you stick it into context, and then after it's already been there for a while, you decide did it work or not, right? And if we put that together with this notion of, well, we're trying to learn, right? That's not actually the kind of information that we need to learn in order to improve. And I think the other thing I resist a bit is we've talked a bit about tools, 3 different tools this morning, right? The big data, the developmental evaluation, the shared measurement. I think of those as tools or methodologies, right? And putting those in the first position can be somewhat problematic. So just having more measurement or using big data or sharing measurement actually also probably isn't going to get us what we need in order to actually learn how to improve, right? And in fact, when we think about it, that's just one of the set of things you're going to actually need in order to improve. And measurement isn't just measurement, right? And learning to improve versus evaluating or deciding, holding yourself accountability, it's not just a different intention with the same measures. It's fundamentally different information, right? So whenever we're talking about building a measurement system or thinking about measuring, the purpose has to come first. And then we have to think, okay, to get to that purpose, to answer these questions that we really have, what are the actual measures that we need in order to answer those questions? And so at Carnegie, our sort of theory about how do we really accelerate our capacity to improve, right? Putting that in the first position is the deep purpose that we're around. We are trying to approach it through 2 different approaches, which again, I think will echo a lot of the themes of other folks and what they're working on. The first is the power of networks. This notion that we can do a lot more together than we can ever do alone, and that we need multiple forms of expertise in order to solve some of the complex problems that we're after today. And the second is this idea of improvement science, which was embedded a bit in the shared measurement presentation this morning. But the improvement science is this idea of having a really rigorous methodology around improvement. So just as in research we have a rigorous methodology around figuring out what works, the improvement science gives us a rigorous methodology to figure out how to get something to work. So those are the 2 big ideas that we're trying to pair together in order to really accelerate the field's capacity to improve. And measurement turns out to be just one of the really important resources that we use in order in both of those 2 different strategies. And just to give you a little bit more of a concrete picture of it, so what we'll start with often is a really high leverage problem of practice. And so in education, one of our really high leverage problems of practice that we're working on right now is the really high failure rates of students in remedial math courses in community college. So those of you know a bit about community colleges, you've got lots of students who go from almost half actually of the students that are in higher education right now are in community colleges. And when you go, you take a math placement exam and you place into some level of math. And you often, many of the students, 60 to 70% of them, have to take 1 or 2 or 3 remedial math courses before they get a college level math credit. And very, 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 very few ever get that college level math credit, which has huge impacts on their livelihoods, their abilities to support their families, their ability to pursue professions that they really care about. So how do we approach that problem using networks and improvement science? Is we gathered together a host of faculty from 18, in the beginning it was just 18 community colleges across the country, united them around a common aim. We developed a pathway to and through a college level math course. But unlike many of the other efforts that we often do, we didn't design it for years and years and years until we had it perfected and then stick it in. What we did is we developed just enough so everybody would be working in common, and then gathered around a whole network of the kind of expertise we would need to continuously improve the pathway over time. And measurement is an incredible resource to us in this endeavor, because the measurement is what gives us feedback across the network about where and how we need to improve. And so in the network, everybody's learning, right? So the faculty are learning how to improve their practice. The institutions are learning how to get this pathway to work within the complicated system that is a community college. And Carnegie serves as the hub, which is very similar to a backbone organization, because there's a lot of learning we could do across the network because everybody has shared measurement. Now we can start to see, oh, where does it work? Where does it not work so well? How do we need to adapt it so it fits into multiple different conditions? Because ultimately, these problems that we're trying to solve are not just about figuring out the solution that we're just going to then distribute to everybody, right, across the country, but you're going to try to figure out how to get this solution to work in the hands of really diverse practitioners in very complicated contexts. And we can learn how to adaptively integrate all of our solutions in order to actually achieve the outcomes we want at scale. So the measurement is our resource for that sort of piece, which is very, very different than thinking, you know, did this program have the impact we wanted to? It has to have the kind of information in it that actually allows us to learn to improve. So we use developmental evaluation primarily to help us figure out how to initiate networks. There at the foundation, what do we need to learn and how do we do that, and can we feed that back into the networks? Shared measurement is an incredible resource for us as the hub of that network, so we can compare across all of the different institutions that are working together. And because a lot of what we're doing is trying to embed measurement into the daily workings of folks, right? That's what the faculty need, is stuff that's very connected to what they're doing. We're going to have to use new technological tools to make it easy, because it has to be feasible. It can't become the thing that they do, as opposed to, you know, we want them to be teachers with a little bit of data along the side. And so I just think that's the way that we use all of those different strategies, but for really this purpose of thinking about how do we learn as a community, as a group, in order to improve.
Thank you. Faye?
Good afternoon. So when we were preparing for this session, Sri framed the question as, you know, reflect a little bit on how do traditional evaluation approaches compare with the next-gen approaches. This was maybe the third or fourth time Sri and I had a conversation along these lines. And it made me think about many different ways of framing traditional versus next-gen. And I thought about, you know, what do I prefer, like chicken matzo ball soup versus a crostini with heirloom tomatoes drizzled with truffle oil? You know, old versus new. And they both have their place, right?
Is one homemade and one not? Or?
They're both homemade.
Okay.
And that's a really important point. That's a really important point, because most of the conversation about these methods and about old methods and new methods, half of it is how well it's done, right? You can do a great RCT and you can do a crappy RCT. You can do a really expensive one and you can do a less expensive one. You can do really good implementation evaluation and you can do really lousy. You could do really good mixed method, or you could do really lousy. You could be very neutral, or you can be more subjective. I don't know any evaluators, actually, in my history of doing this work, who don't want to make meaning from evaluation. Never met one, actually. So I'm glad that Next-Gen involves meaning making, but I think actually it's not that helpful. So here I'll be a little bit provocative. It's not really that helpful to say that's new, because I actually think there's a lot from old that is important. And so as a person with aging parents and upcoming children, and I think about the generational divide, I think, well, let's honor our ancestry. There's a lot that has developed and changed in the field of evaluation that I've been part of that has been really healthy, actually. And I have been a real critic of the field of which I have been part. But I also think it's important to honor parts of the field. And so as I was preparing, I'd taken a little bit of a different tack here. I was thinking back to the 1980s is when I started to get involved in the field of evaluation. And so I thought, well, what is traditional? When we say traditional, what does that actually mean? And so I started to write down in my own history. So it's an imperfect timeline. It's just the timeline according to Faye Twersky. But in the 1980s, there was lots of focus on outcomes. Outcomes was the new thing then. I don't think it was actually that new then, but we talked about it as the new thing then, as outcomes evaluation. It was formative and summative, but there was certainly a lot of meaning making, but we were all struggling with outcomes evaluation. And then in the 1990s, there was lots of sort of new business people coming into the sector, and so there was lots of work on social return on investment, and I see some old colleagues who were part of that work that I was involved in at that time, and it wasn't perfect, but we were trying to make meaning and do actually shared measurement, and there was lots of, at the time, indicator tracking. We were trying to track indicators and using scorecards. It was imperfect, and we didn't always know, well, if indicators are changing, what does that actually mean? You had to actually go out and talk to people to make meaning of it. And then in the 2000s, it wasn't the beginning of RCTs, but that was when we really got much better at understanding the value that RCTs actually could provide in terms of understanding causality and attributing change and trying to really make programs here and around the world a lot better. And now recently there's more focused on shared measurement, more focused on mixed method, more focused on big data, more focused on developmental evaluation. And I think all of that is good. So my answer is you need both. You need the traditional and you need the new. You always need to get better at whatever you're doing and do it at a high quality way. I'll close with one point, which is, when I first heard Michael Patton talk about developmental evaluation, what I liked about it was he didn't actually talk about it in the way that, that some people do, which is pre-formative. He talked about it as when you have complex systems and you need to adapt those systems and those programs in an ongoing way, you need some kind of evaluation that will be developmental in nature, that keeps pace with the interventions, that keeps pace with, as you're learning in real time, you adjust the methods. And I think that actually that's a helpful addition. I think there's a lot of work that we're all doing in complex systems that does require sort of ongoing real-time evaluation partners, and I think we can get better at that in part by learning from history.
Thank you, Faye. I'm just going to pick up on that. Actually, maybe let's go a little deeper. And Hallie framed this morning as a both and as well. I mean, so not just, but also. But what does that really look like? I think we all agree, yes, it's both and. Like you said, we haven't met an evaluator that doesn't want a meaning make. I haven't met a person who doesn't agree to a both and framing. But what does that actually look like in practice? And so if we have to, if next generation evaluation has to honor the legacy of the evaluation that's come before it, what of that legacy do we hold on to, and what of that do we let go of to really honor it?
And you might ask also, where does the old and the new, where is the tension between the old? If the old was, does it work? Yes or no, right? We got a lot of that. I mean, I'm so old that I go back to when good intentions and an anecdote were good enough. When I came into government in the mid-'60s, I was in the poverty program at the beginning, and that was what people were looking for, good intentions. And then slowly the people came over, the whiz kids came over from the Pentagon and wanted to have some numbers and so on. But the issue that I think we're faced with now is when we're saying we really want to learn and we understand what all we have to learn about, and it's deep. Can we do that and still answer the question of, so does it work? Are we getting our money's worth?
Can we?
I think it's really hard. I think it's really hard to do the learning and to amass the kind of documentation that will satisfy some of our funders. I mean, after all, we have the director of OMB the first director of OMB in this administration, Peter Orszag, saying the only kind of method that is bullshit resistant is random assignment evaluations. Okay, that is a part of the world. That is a part of the world that has not made its way into this room today, but that doesn't mean it doesn't exist and that we don't have to talk to those people. And are we going to change what they are looking for? Are we going to change what funders and policymakers want from us by telling them, listen, what we are learning about is so much deeper and so much more important and will actually get you to better outcomes? I think that we have to learn ways of really doing both. And I've heard an occasional example of people who are really doing both, but it's not very widespread. And I think those of us who are trying to do what we all agree needs to be done, which is to learn as much as we can so that we can get better outcomes, we are at risk of not satisfying those demands for really rigorous proof that what we do works on the yes/no question.
Alicia, can we do both?
So I think you can do both, right? I think the question about are we having the impact that we wanted to have is a really, really important question to answer. I mean, you really do have to look at, are we having impact, especially in the nonprofit sector, right? We're using public funds. Like, we're responsible for saying, are we having that sort of impact? I think the problem with there's a lot of problems with only asking that question about are we having the impact. So I would say at Carnegie we have a fairly large, for as small as we are, analytics team. I would say probably we spend maybe 5% of our resources asking the question, are we having the impact? And 95% of the resources trying to figure out how to have a bigger impact over time. So we ask the question, but we do have limited resources and we are balancing both of those things. And I think part of the problem with asking that question, I mean, if you think about it, for everybody who's worked in the social sector, and you think about a program, and you think about it being implemented across a variety of contexts, you think about some sort of methodology that says, did it work or not? What's the average effect size? So sometimes you have a positive one, sometimes you don't. The real answer is, well, it worked some places and better than it worked other places, right? It worked here and it didn't work there, right? So it's very hard to find something that works everywhere, but it's pretty easy to find to get something to work somewhere, right? And so the question really, are we having the impact or not is one thing, but what a shame it is that we go out and we implement this in all of these different places. It works some places more than others, and we don't learn anything about what they did in order to make it work in those places. That's awesome learning, because they did something, they figured something out. And in fact, the places where it didn't happen, where it failed, there's a lot of learning to happen there too, because something wasn't in place. Something about that local context or how it was used wasn't able to happen. And I think some of the shame of stopping at that question, did it work or not, is there's just so much learning that never happens, right? There's so much there that did happen, that people did, that never comes to the top. So yeah, I think you can definitely do both, but you have to ask a different question, right? So you have to ask, how do you get this to work across 4 different people in different contexts? How do you do that? And you have to go looking for that, and that's going to require you to have a whole different method for using data, and it's also going to require looking for different sorts of information than we typically look for.
And Alicia, I know you mentioned the field of improvement science earlier, and I know one of the tenets of improvement science is to ask, under what conditions does it work, for what populations, in what circumstances, in what ways? And do you feel like evaluation needs to sort of absorb that from?
So the goal in improvement science, at the end of the game, the goal is efficacy with reliability at scale.
Yeah.
Not a solution that works, but efficacy with reliability at scale, which is a totally different piece, right? So by nature, if that's what you're aiming for, I'm aiming for reliability, right? I'm aiming that every third grader in this entire district learns how to read, right? By nature, your methods are going to be different because you're trying to figure out how to get it to happen across all of the different contexts.
Okay. Reactions?
Yeah, I'm not sure what the question is, but I'll say.
We're still in the. Can you do both? Can you do both? Can you do both?
Here's what I'll say. The irony actually is that I agree with what Alicia just said. That so much of evaluation really depends on the question that you're asking and how crisp and clear your question is, or questions are. And so I guess to pick up on something that Lee said, I don't. Sometimes the question is really about impact. It's really important. You know, if you know a loved one is going to undergo a clinical treatment, you want to be pretty certain that that is likely to succeed, if you can. You want to increase your certainty. If you want to understand if something is being implemented in a certain way, a program, you want to ask those questions. So being clear on the purpose and being clear on the questions is really important. It's a step that you can't skip, and also to make sure that you're framing the questions in the right way. I was sitting here thinking about at dinner time. I don't know how this happened, but my son, I have a 12-year-old son, and every night he likes to end his meal. Doesn't matter what he's having. He likes to end his meal with a string cheese. Just has always done it, and this has a point. And if you were to say to him, which I have done many evenings, Dave Nathan, are you still hungry? And there's vegetables and other healthy things on the table, he will say no. And then he will go and march to the refrigerator and get a string cheese. And then I think, well, I'm not asking the right question. And it really is the same thing with evaluation. Whether it's an implementation, being clear about the question is so important. What are the questions that you really want to ask? What are you going to do with the information that comes back? How certain do you need to be? What is the context that you're working in? What's already known? You know, we had a presentation earlier from James, I think his name was, right before this session, and he was saying, we learned 3 things, and the first thing, maybe we should have known that already. And I think that's true a lot of the times in evaluation, is we get back learning. The classic one is, it took more time to start up this program than we expected. So what are the really important questions that are worth spending time and money on? And then really putting time and money and right methods and mixed methods and time for reflection behind it. Sometimes you really need a lot of certainty. Sometimes you're really innovating and you need to test out some different things. Being clear about what your assumptions are and what your questions are. There's no substitute for those.
For that. Thank you, Faye. So let's get a little bit more specific about these approaches we talked about today. And as you said, Alicia, they're tools, methodologies, approaches. And we talked about developmental evaluation. We talked about shared measurement. We talked about big data. But we've been clear that these are not the only approaches that represent next generation thinking. So I'd love to throw it back to you as you sort of put on your thinking caps and have your vantage point in the field. What else do you see emerging out there which is either new and different, but represents the next generation paradigm, or maybe is a melding of different approaches in a way that we haven't thought about before? So actually I'll start with Faye, if you don't mind, and then walk back this way.
Good. I'll say 2 things, 3 things. One is, I think this conference actually, I was saying to Mark over dinner last night that this, is a sign that there is a really pent-up demand for this subject. And we may not agree on everything, but that people really want to understand and wrap their head around the subject of evaluation and get better at it, and really wrestle with those things. you know, I think going forward, you know, we need to continue to get better and take advantage of the appetite, which relates to the second point, which is that, you know, as important as the evaluation methods are and the evaluators are and the skills and the technical pieces of this work are, it really is the program people and it's everybody else that actually matters more. Because it's the program people that can really demand. We want to be self-critical. We want to understand what is working, what isn't working, who is it working for, who is it working for less, how expensive is this, how can we improve, how can we get better. And so it really, I think this meeting and meetings like it signal a kind of a culture change about learning that I think is important, and learning in all kinds of ways. And then I'll make a more specific point about going forward into the future, which is that those of you who know me know that this is a great area of passion of mine, is making sure that we not only listen to experts, but that we listen to our ultimate intended beneficiaries, the constituents on the ground, the citizens in the communities that we work with, the participants in programs. And how can we listen to them, not just anecdotally, but also systematically, and listen to their views, their perspectives, to help drive improvement, to help us drive better understanding, to ask them the equivalent of not just are you hungry, but do you want a string cheese, you know, to make sure that we're framing the questions and really listening hard to the answers to help shape our thinking about how we can improve what we do, what we fund going forward. It's not the only input, but it is an under-tapped source of insight and wisdom that I hope we do a better job at going forward.
So I think we're really, particularly in the education sector, really excited about the notions of improvement science. So a lot of what we're trying to do is figure out how to bring these methodologies of improvement, systematic methodologies for improvement, into education. And we study healthcare a lot as some of the quality improvement as it's happened some places as inspiration for some of that work. You know, there was I remember hearing back a while back in medicine that they said that, you know, can you guess on average how long it takes it to get an idea from research into daily practice in medicine? Right. It takes about 17 years. Right, for an idea to be discovered, for it to get to happen regularly in everyday practice. And, you know, at least for those of us in education, it's sort of stifling because there's so much more money in professional preparation and in medicine than there is in education, right, than there ever could be. And so this notion that they needed in this world that was rich with research and rich with all of these things still needed this methodology for improvement was something that we really took seriously and started thinking about. And at the sort of base of improvement science is this way of thinking that everybody in your entire network or in your entire organization goes through, and it's really around three questions, which are so simple but so powerful. This notion of what is it that you're trying to accomplish? What changes can you introduce that might lead to an improvement? And how would you know that a change is an improvement? And that sort of thinking embedded in everybody in the organization from the bottom to the top, right? And you can see already how data is going to come into that and how measurement's going to come into that. That sort of thinking makes it more likely that changes lead to improvement, right? So there's this wonderful adage in improvement that all improvement requires change, but not all change is an improvement. And you know, when we look in education, and I'm sure it's true in other fields, there's plenty of change going on, right? And there's plenty of folks on the day-to-day basis, the frontline workers, there's all kinds of change going on. And the real question is, how do you harness that in such a way so that it's more likely to lead to the improvements that we're after? And so I think improvement science for us is just a really exciting set of methodologies. It embodies a lot of the things that we've been talking about in the last couple of days, but really sort of pairs it with an engagement and a disciplined methodology to really get you there.
Lee?
3 points. One is about certainty. One is about data, and one is about context. I think in what we're all talking about here, we are getting away from that certainty is the be-all and end-all, and that when we are less mechanistic, less linear in how we think about evidence, we may have to give up a little certainty. but that certainty that risks stifling innovation, and I love the phrase miniaturizing ambition, and actually reducing our opportunities to achieve breakthrough impacts. So I think that's one thing that we are talking about here. We're trading off a little bit of certainty for much greater knowledge. Secondly, we've heard both sides of worshiping at the data altar today. And I think it's very important for us to keep in mind that there are limitations to saying that data is our be-all and end-all. And I love the quote from Andrew Natsios, our former head of USAID. He said, "A narrow reliance on numerical results is at odds with the fact that transformational programs are often the least measurable." And let's just keep that in mind as we think about how we're using data. And the third is context. We've all agreed that our evaluations need to ask not just does it work, yes or no. We have to talk about which populations, what conditions, what time span. We also need to know about the context. Jeff Braddock at Bridgespan has a TEDx talk in which he talked about the difficulty that youth villages had experienced in spreading its well-proven, well-documented model from Tennessee to other child welfare systems. And I think what that trouble that they've had with this wonderful proven program and getting it integrated into child welfare systems is that we need more than proof that a program works. We need to know about the decision makers and the funders and so on, what they are bringing to the table, including their knowledge, their experience, their skills, their judgment, their values, their beliefs, their ideology, their resources, and maybe most important, their pressures to maintain the status quo. So when I hear about a wonderful program, I want to know how they've dealt with the context. If it wasn't hospitable to start with, how did they make it hospitable?
Mm-hmm. Great. So I'm just going to do one more question and then open it up to the audience. So this is the $1 million so what question. There are multiple groups in the room. The main ones are funders, nonprofits, government, and consultants/evaluators. So if you think about implications of these ideas and these approaches for each of these groups, what comes to mind for you? And if I could typecast a little bit, could I maybe ask Faye to talk more from a funder perspective, Alicia from a nonprofit perspective, and Lee from a government perspective? What does this mean? And then we could ask all of you to give advice to the evaluators in the room. So Alicia, you want to start maybe, or?
Sure. So, yeah. So I think I've said it before, but I think one of the big pieces for us is the questions that you ask, right? So we're just driven to understand what works for whom, under what set of conditions, over and over again. I think paired with that, for at least in our case, the kind of capacities you need, I think, which we started to talk about a little bit this morning, the kind of capacities you need in an organization. So for us to be a hub organization, what are the different kind of capacities around data, around improvement, around technologies? I think that has a big piece of it. One of the things that we, there's a way of thinking about improvement also that you think that what do you need and actually to get improvements to happen, that you need will, you need ideas, and you need the capacity to execute. You need all three of those things. And sometimes I think that we know we don't have those three things and we still go for a really large scale. Our approach has been to start at a place where we know we have the will, the ideas, and the capacity to execute, and try to systematically build that, which takes a little bit of courage, because it means sometimes you have to be willing to go slow at first in order to really accelerate and be able to go fast in the long haul. So I think it's just a very different way of working. I mean, maybe the last thing I would say is, you know, if you really believe in this sort of continuous improvement ethic and getting everybody to the table, you have to be sort of willing to go out with things that are less polished than you're comfortable with, and you have to be a little bit more comfortable. You need to, if you're not sure about your ideas, you work on a scale where it's okay to fail, and you need to be okay with not knowing, not having the certainty, as you were saying, going forward. But I think it's just a really different way of approaching problems, of engaging folks, of staffing nonprofits in order to do that kind of work.
Got it. Faye, and then maybe we'll give Lee the last word.
Sure. Well, for funders, you know, funders' greatest asset is money. So I guess the first thing you should do is fund your grantees to do evaluation, to do their own measurement.
Simple as it may sound, it's actually a pretty epic statement.
Yeah. Ask them what's important to them. What are they trying to accomplish? What are they measuring? They're not always going to be measuring, but maybe if they had more funding to do so, they might. And when I was on the other side, the consulting side, I used to always say to nonprofits, you know, get ahead of your funders. If measurement's important to you, do it. And your funders most of the time will follow. Not all the time, but it's more likely that they will. So fund your grantees, ask them what's important. You know, in our shop, we integrate strategy, evaluation, and organizational learning into one team. And I would say that that's working pretty well. So that would be my advice to other funders. That is, evaluation has to follow strategy in the sense of you want to be measuring something that you're intending to do. And being clear about your strategy helps you interpret the results. You don't have to pinpoint, but I remember just maybe about a year ago, I was having a discussion with a colleague. We got back some evaluation results, and while they had been clear about the general strategy, less clear about what the result might actually be. And when we got the evaluation back, my colleague said, well, that's pretty good result. And I thought, that's not very good result. And so, you know, without having been clear about what our assumption was, what might be good, what was actually the target, we were able to create our own history and own reality of what good was. And so it really dwarfed the learning. So integrating strategy, being clear about what it is you're trying to accomplish, can only help you learn. It's sort of the essential element of evaluation, which is comparison. So if not to a control group, at least to what did you think would happen? Compared to what? A third thing for funders to do is walk the walk. So if we're asking our grantees to evaluate their work, be rigorous, be metrics oriented, we should be evaluating our work. Take the time to reflect, meaning make, I think was the new phrase you used. Make meaning, you know, take the time to reflect. That's not a new idea. Don Schoen wrote about reflective practice at MIT back in the 70s and 80s. Really important work, and taking time to be a reflective practitioner, a reflective funder, I think there's no substitute for that. And then finally, the last piece of advice for funders is to share the lessons. Be open. Be open about what we're learning, what we're doing well, what we're not doing so well, where our assumptions bore out to be true and where they didn't, and where we had failure. And we have no stock price and we have no funding needs. So there's no reason why we shouldn't be able to share those failures and share our learning so that others can benefit from them and make new mistakes, not make the same mistakes.
Lee?
I've been thinking all day, I didn't know you were going to ask me this question about the implications for government funding, but I've been thinking all day about the bubble that we are under here, that we are living in a sort of a grand paradise where people can reflect and where there's new money. And yeah, I live in Washington,
called
D.C.
Stanford.
And the idea that we need to also be responding to those pressures, and not only responding to those pressures, but trying to explain to OMB, to the Government Accounting Office, that there is value in learning and reflecting, for heaven's sake, and that they will get more from us if they will allow for a broader kind of knowledge building. And I think that if we're going to have a movement, it has to be a movement that is about more than evaluation, because what we're talking about here is we're talking about how to improve lives. And a broader way, a next generation of evaluation is only one way that everybody in this room is trying to get there. So we have to figure out, you know, what is the umbrella we can organize under, which may be broader than evaluation, but we also have to figure out how can we convince the people who have decision-making power over most of the funds that we're interested in, how can we convince them to think not entirely like us, but a little bit more like us, a little bit more where we value more and deeper learning, where we value improvement. And what we haven't talked so much about here is what do we have to know in order to design new interventions, in order to make giant leaps to better outcomes, which takes more than improving what we're already doing now. So all of those things, I think we as a group have to get better at, and then we have to start being able to communicate some of that to the people who have control over so much of the money and so much of our lives. And for those of us who still believe that government can do good, we have to help government to do good.
Great, thank you, Lee. Well, on that note, why don't we open it up to the audience? There's standing mics all across the room. We just requested if you have a question specifically addressed to a panelist, please say their name. If not, throw out the question and we'll see who's game.
Hi, I'm Randy Barth from Think Together. For anybody, it seems to me there's this sort of, it's been talked about in several of the breakout groups and up here, that there's this kind of assumption that it's really hard to change what's going on in Washington for this group and others like us to sort of influence that. But it seems to me a lot of the people like us were the ones that influenced Washington to do this RCT stuff and all this stuff anyway in the first place. 10 or 15 years ago, we weren't doing this. And a lot of folks have gone, they've gone to Arnie Duncan, and they've gone, folks, and this is the way to go. Doesn't seem to me, and I'd be, pushed back on this, that we have to be stuck there. And if we're in the capital of innovation here, if we're going to innovate and have iterative thinking, why can't this be iterative thinking?
Ooh, I love it. So do you have some ideas about how we might go about this?
How did we go about getting RCT embedded in the first place in DC? It wasn't there 10 or 15 years ago.
Right, but what it did was it really fit a lot of people's agendas. It fit the agendas of people who didn't want government to do a lot. So if you say you're only going to fund proven programs, then you're already very limited in what you can fund. And it also fit people who just wanted to be certain in this, to quote Jeff Braddock again, he says, in this fog of what works and what do we do and how can we do it right, to say, oh, we have the answer. Anything that is proven to work with an RCT works. We know that isn't even true, but it's very appealing. So what we have to sell is much harder to sell than the narrow approach that we've taken.
But it seems what we're trying to sell is innovation. In a global economy, in a very dynamic world that's changed more in the last 5 years than maybe in a really long time, that there's an innovation agenda that I think wraps around this that can at least be a segment of the conversation.
That's great.
Can I just throw in here? I don't really have an answer to that question of how to influence Washington. There are many better people to answer that question in this room than me to answer that question. But I would just observe that if I were in a different room, we would have people who were total RCT advocates who would have this same critique, who would say, you know, only like less than 1% of the government money actually goes to RCT-proven programs. If the Coalition for Evidence-Based Policy were here, they would have the same critique. So it's interesting just to say, it's really, you know, we're seeing, just each of us seeing, you know, different legs of the elephant. Just wanted to point that out.
Go ahead. Oh, sorry, Alicia, did you have?
No, I mean, the one thing I would say about it, though, is at least in the field of education, the whole notion of RCT has completely changed what constitutes evidence in the field, right? So even if we change tomorrow what's happening in Washington, this notion that the only way you could have evidence that anything works is through an RCT is really deep into the culture of education, educational research, and we fund millions upon millions of dollars of RCTs, and we find out from the RCTs, you know, the byline of most RCTs is, well, implementation matters, right? Well, okay, so implementation matters. We've learned it, and we've learned it over and over and over and over again. I mean, the RCT is an incredibly useful methodology, incredibly rigorous, awesome methodology for a particular subset of questions. And we've somehow thought that it is now the hammer that we have to attack any question about anything from, right? And so I think it's that it's not just what happens in Washington, but it's this, how it's changed what we think about what counts as something working, and that's the only way that you could, RCT has become synonymous with rigorous, as if the only thing that is rigorous is an RCT, right? Exactly. Well, it's rigorous for a particular sort of question, but it's by far not the only way that you can answer questions. So I think, aside just from what Washington's doing, right, and they control a lot of money and they require certain sorts of evidence, there's just this thing that we live with as a field around what constitutes evidence that we also have to wrestle with.
Just say, in response to Faye about that only one, I know John Barron says only 1% of what we spend has been proven, but one of the reasons for that is exactly what Alicia just said, that there is a very small subset of interventions that we can prove with RCTs. We simply cannot measure, we cannot do the measures, we cannot do the random assignment with most of the things that are going to change lives because they're too complicated. I mean, that's what the whole collective impact thing is about. The complicated nature of what works and which cannot be assessed with random assignment methods.
Got it. So why don't we take a question and then there?
Yes, so this is addressed to anybody who can tackle this one, although I want to start with something that Elizabeth said, that perhaps as we move forward, we may be needing to give up some certainty to foster innovative ways to do these evaluations. And I'm just wondering, it seems to me there may be a countervailing trend out there which also calls itself innovative, which is this whole idea of social impact investments. So I've also been trying to get up to speed on what that means, and there's new buzzwords out there about social impact bonds and pay for success and so forth. And the idea is that impact investors or the government will be willing to invest in interventions that are proven to work, that are evidence-based. And not only are that they're proven to work, but they want to see the fiscal impact too, so that they can say, we will invest in that because this will save us, you know, it will save the government X number of dollars. And, I'm not an economist. I'm not even sure you can actually say that about anything. But, so I guess the question is, because I was trying to formulate, what is the question? The question is for me, is this a countervailing trend, or is there some way we can be complementary here? Because I'm not sure how we can apply these new generation evaluation methods to these new innovative investment strategies. Is that clear?
Is that
Okay.
you want to take the Faye maybe?
Well, I'm not a social impact bond expert, so I'm reluctant to comment too much on it, except to say that it's really an innovative financing mechanism that's used in a somewhat narrow way, being experimented with, where it does it's a pay for success, pay for performance method that does rely on studies that says, if you meet, based on studies, we think that, your level of recidivism will be X. If it's actually X plus 10 with the same kind of people, you get financially remunerated. So the nonprofit who over-delivers on the results, on the outcomes, actually is financially rewarded. But there are people here who understand the social impact bond better. But it's I wouldn't say it's ubiquitous yet. I think it's being experimented with. It's innovative. It does rely on measurement. You have to have good measurement systems, shared measurement systems, and good studies underneath it to make it work. And it's being tried, I think, in interesting ways in prevention programs.
And actually, if I could just offer one thought there, I mean, the result of something like a social impact bond is probably lends itself more to an RCT or a more traditional evaluation, because you have to know whether something worked or not, so you can actually know whether to pay the nonprofit. However, the process of how that comes together, since it's still a new innovation that's being tried and tested and not a lot of people have done it, is probably more attuned to something like a developmental evaluation or Nextgen. So it's I think you have to parse out the process of how it works and the results a little bit. So. Go ahead.
Hi, thank you so much for this conversation. I think my question, and then I'll give a couple of contexts for the question. My question really is if the panelists, any of you, could comment on the place or role of organizational level evaluation. Some call it organizational performance, but we talk about program effectiveness, we talk about evidence-based programs. I think, Faye, you even said, maybe we can get away from program evaluations. And then we're talking about system level, collective impact, shared measurements. And so my real question, and we know that in the work of complex social change, we are trying to build enduring organizations with proven program models, but there's leadership and there's finances and all these other things around an organization. So could you just speak a little bit about where the organizational level, in terms of evaluating organizations, plays in these conversations? I think those funders who fund, for instance, core support would say that they're investing in the organizations, and it's a little bit of a hamster wheel that we're on here, and that we want core support, but we want to talk programs, and it's easier to fund.
I've been doing some work with what remains of community action agencies around the country. And community action agencies have been doing a really performing an extraordinary role of providing glue, providing connections. They will fund 2 extra hours of a Head Start program. They will fund the development of a universal intake form. They figure out what that community needs in order to make progress on certain outcomes. So they've been told if they cannot prove the impact of their organization, they will not get funded. That doesn't make any sense, because we want them to be doing that. That is a social good that they are doing. They cannot, however, prove that kids are more ready for school because they funded the 2 extra hours every day that allowed mothers to go to work, et cetera. So I think you've put your finger on a very, very difficult problem. And of course, when you're talking about collective impact, you're talking about what organizations can do together. And if somebody wants to tease that apart and find out what your organization is doing and separate that from all the 13 other organizations that you're cooperating with, you're defeating the point, right? So it's another one of those issues where we have to do some education about how just wanting to know what your organization is contributing to the outcomes isn't enough. That doesn't mean that your organization shouldn't be providing some data on performance. It doesn't mean that your organization shouldn't be figuring out what in fact you are contributing and what the rationale for that is. But that is a little short of proving that your organization alone is causing those improved outcomes.
So I have something to say about that. So, you know, a slightly different approach, but I actually think it fits right with what you're saying, is that I think the organization is a really important context, right? So when we think about education, I'll speak about that because that's what I know. How is education organized? Well, you've got classrooms and then you've got organizations, right? And then we put them together in a network. And so we want whatever we develop to work in lots of different organizational contexts, and we believe that there's some uniqueness about organizational contexts, but that not all organizational contexts are going to be unique, right? So somewhere in the middle there. And so an important learning for us is to understand how whatever we're developing has a different amount of effectiveness in different organizations. It's part of the reason we use a network, right? If we were working in one organization, we couldn't actually learn about the organizational context that's really important. But we can if we work in a network. So we can start to say, okay, in these kinds of organizations, this additional thing needs to happen. In these kind of organizations, this part of it won't work. And that's a way we can use it. We can see the variation that happens across organizations, not as sort of an accountability strategy, but as this gives us more information for our own design, so that we can also begin to design something that locally adapts to many different kinds of organizations. So it's a different way of looking. I think you have to understand the organization is a really key concept, a really key structure in which any change is happening. But then how you use that information to really help you develop something that can really scale is, I think, a different matter.
Good. Do you have a brief comment?
Brief, the only thing I would say is healthy organizations matter.
Okay, that was great. In the interest of time, we are going to have to bring this to a close. I apologize. I know a couple of folks have been waiting to ask questions, but I'd like to thank each of our panelists, Lee Shore, Alicia Grinnell, Faith Tversky, for a wonderful discussion. Thank you.